and I've divided my talk into 3 separate parts. The first part I'll be talking about very briefly about side effects and complications in the infraorbital region. Then the second part I'll be talking about the infraorbital region, the teardrop region, is a very unforgiving part of the face. A lot of side effects and complications are as a result of poor choice of filler and poor technique. So the 2.9 lift aims to address both. So it's poor choice filler, poor choice of technique, and we want to address both. Like I said, the 2.9 lift was constructed about 5.5 to 6 years ago, and it's now used in about 40 countries. It's widely recognized as one of the safest and most effective techniques. It is not a perfect technique, but I'm very proud of it. It's trademarked, and I'm the registered owner of the trademark. It uses, initially when I first started, 27 gauge cannula, but I now use more and more to 25 gauge cannula. It encompasses only 2 entry points to minimize trauma as much as possible. But most importantly, when it's done correctly, it helps you establish the correct depth of injection, which is very important. And most importantly, we want a procedure that is predictable. Let's go through very briefly the side effects and complications in this part of the face. Number 1, it's not uncommon that we get to inject the filler too superficially. As we talked about earlier, a lot of the side effects and complications are as a result of poor placement of filler. So we want to be very careful. We have the skin, we have subcutaneous part, then we have the orbicularis oculi, and finally is where our target placement of filler should be, which is the deep fat compartment. Okay, I'm just going to sit Valeria forward.
Adesso questa è Valeria. Le chiedo di sedersi un po' in
Valeria
avanti,
is
così.
41 years old.
Valeria ha 41 anni
And she's not had anything done in the past.
e non ha avuto nessun trattamento in passato, non ha subito nessuna procedura in passato.
I have 2 objectives for this 25 minutes, which is very short.
Io ho 2 obiettivi per questi 25 minuti, che è un tempo molto breve.
I would like to show you the techniques, but at the
Vorrei
same
mostrarvi la
time,
tecnica, però allo stesso tempo
I'm aware of the fact that
mi rendo conto che
we don't want to use a lot of products.
non possiamo utilizzare molti prodotti.
An imaginary line between the tragus and the lateral area.
Faccio una linea immaginaria tra il trago e la laterale.
Anything you inject above this line, you want to
Tutto ciò che
inject
andate a
deep
iniettare al di sopra di questa linea dovrà essere fatto in profondità,
into the deep fat compartment on the bone.
proprio nel compartimento in profondità sopra l'osso.
Anything you inject below this
Qualsiasi
line,
cosa che andrete a iniettare al di sotto di questa linea che ho tracciato
you want to inject subdermally.
sarà qualcosa di sottorage.
Your target depth is the deep fat compartment.
La profondità, il target di profondità è questo compartimento adiposo
And you will use bolus technique.
e andremo a utilizzare la tecnica di bolus.
And my aim is to use a maximum of
Il mio
0.5
obiettivo è di utilizzare un massimo di 0.5
or potentially less.
o potenzialmente anche meno.
I've got the Tiosial pen,
Ho la penna Tiosial
and it's got redensity 2 inside,
che ha questa particolare densità all'interno.
This is also a 25 gauge 50 mm cannula.
Questa è una cannula di 50 mm 25 gauge.
I'm going to treat the tear trough area and the infraorbital hollows.
Andrò a trattare quest'area e la cavità infraorbitale.
Now, one of the most challenging things about rejuvenating this
Una
part
delle
of the
cose,
face, this is why I chose this entry point, because you
ed
want
è
to
il motivo
soothe the
per cui ho
skin.
scelto questo punto di entrata, perché vogliamo come spazzare la cute. Le ho anche detto che avvertirà una leggera pressione in quest'area.
How am I doing with time?
Come va col tempo?
I have
Adesso facciamo alzare Valeria, la facciamo sedere in posizione retta.
Right, now I'm going to very quickly go to the other side and I'm going to finish
Adesso
up in